Good morning. Today is Thursday and I'm headed to work. So this is a day in the life of a primary care doctor during COVID. It's a little different because I'm not seeing patients in person. I'm doing telemedicine, so you'll be seeing me mostly in my office. However, I will be able to show you one of my exam rooms. I have 3 of them, but they're all about the same. Anyways, running late, about to drop baby off at daycare with Dadu, and then I'll show you what I do. Bye. So Baby's in the back. I just put on my mask because we need to mask up at daycare and my work, and I'm about to head there. My husband forgot his phone, so he's going back. So I just got to work in my office and I can take off my mask. I work with 4 other partners and I'm about to do telemedicine, and so I don't actually go into the office exam rooms. I'm gonna start. And I wiped down my area for just a little bit. This is the dragon that I use to dictate. In the beginning, I just check for some labs and do some paperwork. There's this woman with a potential mass, and I have to give her some results. We don't know what that mass is, but it'll likely need to be evaluated with a biopsy. Patient didn't pick up, and so I will be having my medical assistant call her again later because these are important results. I have to put in a referral for her to get that biopsied. I just finished a telemedicine visit for a patient. We did some screening stuff and I ordered some blood work as part of her medication monitoring system. But there's a phone call. Hold on. Hi, this is Chen. Yes, I did. Can you send me back that message and then connect me, please? So that patient called back, and we're going to try to get her into a physician to biopsy that lesion. And so I just got a message from my medical assistant that a patient later on today will cancel because they forgot to get labs, and that's very common. Again, I mentioned a lot of my job is paperwork, and so I have a lot of scanned-in paperwork that I have to review and see if they warrant any further follow-up or anything like that. And my MA is continuing to keep me updated on the patient scheduled for telemedicine today. Later on, I will have to go get my flu vaccine, and that's going to be very important this flu season because with COVID going on, it's really hard to tell which one's which. I forgot to eat breakfast today, and because I was running so late and I woke up so late that I made myself some wraps, and I'm going to eat them as I work and read. And I forgot to show you my outfit of the day, actually. So I'm wearing a sweater because our weather in the mornings are so cold. It's like 30-something degrees. Coming down, just black pants, my Toms, and I have my white coat, and I don't wear scrubs. I wear just professional clothes because I'm in an office setting, but those are what I wear if I were seeing patients in person, which I'm not doing at this point in time. I'll eventually have to see them again. Anyways, I'm about to eat my meal, read some more paperwork. I made myself grilled chicken wrap with sweet corn, cheese, and spinach and mushrooms. So I was scheduled for a patient at 9:30 to 10. However, that one we weren't able to get a hold of him. So my 9 o'clock patient did call back, so I'm about to do a telemedicine visit for that one. So I just finished my 3rd patient of the day, and she had really bad neuropathy that we have maximized her gabapentin and it didn't work, and I tried some Lyrica and again it didn't work. So my next patient has headaches. It's a very common problem in primary care, and the main thing is to exclude red flag symptoms. I am unable to do a physical exam, which is something I really like to do with headaches, just to make sure, you know, neurologically they're intact. But anyways, I will be talking to her and I will get back to you in a little bit. Daycare just called me and they're saying that she's not taking a feed, so I'm about to run there and give her, nurse her, and then I'm gonna come back to work. This is one of the most stressful parts of my job, is running there. Alright, so I'm heading over to her daycare right now. And when I get back, I'm probably gonna get my flu shot. A few minutes ago, her pediatric office called me and I virtually checked in so that tomorrow we won't have to check in person at the front desk. So I just finished nursing her, and I have to nurse in the car because of COVID. Oh my goodness. I have to nurse in the car because of COVID. And so I'm about to drop her off at daycare, and I have to run home really quickly. So I just decided to drop on home to pump instead of pumping at work. I found it so inconvenient to pump at work because I have to disrobe, change into my pumping bra over there, and then I have to take the milk to the fridge, the one that the whole office uses, and I just don't feel it's comfortable. So I'm coming home, I'm going to be pumping again, and then I'm going to run to work and see the rest of my patients for the day. So I just got home and I'm about to take my prenatal M pump. This is my Mandela Freestyle pump that I used. I was feeling so trapped by my other pump that I had to be stuck to the wall, and so I ended up getting this, and it has really changed my life. So this is what I look like going to work. I have my JCPenney sweater, I have my Gap pants, I have my Target tote, I wear my Target mask, and I wear my sunglasses. And so this is the whole look for basically today. Right, so I just returned back to work and I'm gonna take care of some telephone encounters before I go back and see another patient by telemedicine. So one of the telephone encounters is asking to get the screening mammogram. So the USPSTF recommends screening mammograms for women 50 and above, and if you're between 40 and 49, to discuss with your healthcare provider based on your risks and family history and stuff. So I just got results of a patient's labs which show anemia, and I was going to call him back to see if he was having symptoms of like shortness of breath, fatigue, lightheadedness, because if that's the situation, we need to get him transfused with some blood. So I just finished doing a telemedicine visit with a patient who has knee pain, arthritis, and shoulder pain, and typically I would get an x-ray and kind of get more stories and potentially offer her a knee injection or a shoulder injection. However, since I'm not seeing patients in person right now, I'm holding off on that and referring them to ortho. So it's currently lunchtime and I brought a peanut butter and jelly sandwich. Kept it in the same bread bag. Purell in my hand. No, this morning I made my husband a wrap also, so he's eating wraps. The two ends of the bread. Nobody will eat it but the mom. I'm just looking at the patient schedule for later on today, and I see you've got a patient with MRDD, and that stands for mental retardation developmental disabilities. And so for that one, I need to get the healthcare power of attorney on the phone too, because the person with MRDD can't make decisions, and they're usually staying at a SNF, which stands for a skilled nursing facility, and they cannot make decisions for them too. And so that one takes a little bit more time because you do have to call both parties, informing the healthcare facility and informing the healthcare power of attorney. I'm gonna finish my sandwich. So this is one of my exam rooms, and it's a pretty standard room. You see the sitting bench area, counter for washing hands, gloves. I actually use extra small, which they don't have right here. And usually I have a set of stuff over here for knee injections. And sometimes the patient sits over here, and this is where I work. I basically plug in my laptop sometimes, and over here we have a monitor that sometimes advertises the hospital's services. Again, these decorations are not mine. They're just here because they've been here. And back door. We have a policy that to give us 72 hours for all prescription refills. I'm not seeing any patients right now, so this room remains fairly open, but I just wanted to show you where I work. All right, bye. So I just filled out paperwork for a DNR, and there are 3 code statuses that I usually discuss with a person before signing it. One is full code, which means do everything what you see on Grey's Anatomy and stuff like that, chest compressions, intubation with a breathing tube. Then the other one is DNR CCA, comfort care arrest, which means until that point that the heart stops, you know, you treat the urinary tract infections, you treat them for heart arrhythmias, but if their heart stops, you do not do chest compressions and you do not tube them. And then the final code status is DNR CCO, which is comfort care only. Do not resuscitate, comfort care only, which means you don't do anything but keep them comfortable. So if the numbers look crazy, but they're comfortable, you don't do anything. And that one is usually end-of-life care for people, let's say end-stage cancer, or they just had a really massive heart attack and it's unlikely that they're gonna make it for good quality of life. Or someone who's vegetative, maybe that's an option too. Again, these are very controversial, and I usually just inform the patient what they mean, and I leave the decision making to the patients. I'm going to be seeing another patient, and this one is a little bit difficult because he has a history of not being adherent to therapy. He has heart failure but doesn't like to take the medication to dry out the fluid in his body, and so he's always having shortness of breath. And that's difficult. I mean, no one wants to have to live on the toilet, and that's what almost some people have to do when their heart failure is really bad, because you really have to dry out the fluid and almost consume no fluid, which is very uncomfortable, and the quality of life is greatly diminished. After that, I will be going home. So my baby is in daycare, so I'll probably go home, shower first, and then pick her up from daycare so that she can have all of me. Sometimes home and I'd shower, she would go crazy, and so it was like a very stressful and rushed shower, so I don't like that. And then I'm going to start prepping for dinner. Today is like my Friday because I work Mondays through Thursdays. Tomorrow I have a pediatric appointment I have to take her to. So I just called a patient who had an abnormal HIDA scan, and that's a test to check out the function of the gallbladder. And so I had to refer her to a general surgeon because hers was just not pumping as well. So I just got another telephone request asking for labs before the appointment, which is very common in primary care, so that when they come in, I'm not just ordering labs and discussing nothing. Many people want to discuss the results of their labs, and so that's very helpful to have labs beforehand. Another patient who has extensive metastasis and mass in her belly. They don't know where her primary is, so she's going to be getting standard chemotherapy. So that was daycare. They just called, and baby needs to be fed again because she's refusing the bottle again. So this is second time during my workday that I have to go in, and yes, I am just so hoping she will take the bottle soon, soon, soon. Building that I work at, and I go in through the side entrance. Door policy, wearing mask, which I am, and so I just got back from the second pump of the day, and there will probably be a third one, but as you can see, I need a humidifier behind me. It's still at 20% despite me having it on the entire time. And water's almost out, as you can see. So I'm about to do some telemedicine and see how much destruction is in the telephone box. My current last patient was quite a difficult one. A lot of social barriers, which is a lot of primary care. And some of these social issues I just don't know how to get across. The non-adherence, for a reason that I feel like is quite legitimate, I just don't know how to solve it a lot of times. And we try to get an interdisciplinary team, but I don't know. It's a lot. It's a lot for the patient. It's a lot for the care team, but I'm gonna try my best. Anyways, I'm gonna go home, shower, and then go pick up Babu. It's so hot in this car. In the morning it starts at 30, and in the evening my car turns to like 98-degree sauna. I'm heading home. I'm hoping my husband can get home early. Like yesterday, he had one patient no-show at the very end of the day, and that was such a boon to my day because he was home early to help me out. I think this weekend we have a lot going on. We have to go check out the Toyota Sienna again. We're thinking of buying that car. We also have to go play tennis, and then we have to go to the library and pick up books for Babu. We're going to see the fall colors, but I just felt like with my milk production in question these days, I'm gonna hold off on that. Hey, welcome back. So I just got home, I showered, and I'm about to have some ice cream, decompress, watch some YouTube, and then it's back to picking up Babu. Luckily, I don't work Fridays. All right, digging into cookie dough ice cream. No, actually, it's cookies and cream ice cream. I feel like I deserve it after a long week, and I know I should pick up Babu like right now, but I think I'm just gonna give myself half an hour and then go pick her up because I just need a little time to myself to do nothing. So I just put some fish in a container and with some soy sauce. I'm going to be making that tonight. I'm gonna put it on the... So Babu just got home, brought home her sleep sack, so I'm gonna wash that. And her hair's in a bun. Hi, how's your day? How's your day? You wanna come out? Here, she gets so excited when I do this. Oh. Oh my gosh. Just nursed her, and now she's in her jumper room. Hi. Her daycare teacher puts her in a hair bun because it always gets in her eyes, but we just like it in her eyes. Hi. Hi. Look at the smiley girl. Hi. You like the camera? Ooh. All right, I'm taking Babu for a walk. I just got home. I'm about to saute my vegetables up and put the fish on the grill.
We miss you.
Daddy misses
Love you.
So,
You.
Daddy's chatting with Babu from the bathroom. He's taking a shower since he just got home. And Baby's getting a little bit needy, and so I'll have to get this food going. So I just made dinner for us. It's gonna be trout, corn with sauteed spinach and rice, and I made myself a green smoothie. So we are here and it's 7 o'clock and we're about to go to bed soon. Babu is getting difficult, of course. She's getting very needy and squirmy and just so uncontrollable. I need to corral this woman, this wild woman. All right, we just finished dinner and I'm about to brush my teeth and get ready for bed. All right, bye. I hope you enjoyed this day in the life of a primary care doctor. Bye.